All right, good morning, everyone. Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractic physician at Gates Brain Health. What we do is referred to as functional neurology, where we work with patients from a natural perspective using brain exercises. For those of you who have balance problems and dizziness, think of them as vestibular rehabilitation techniques along with dietary modification, dietary therapies, and supplementation. I just did a broadcast on Meniere's in connections to the gastrointestinal tract, and now I'm talking about gluten imbalance issues. Gluten imbalance issues are very well researched, and if you know someone with ataxia, as it's termed, or their balance is off, and they've seen doctors and they don't know why, and some of the ominous factors have been ruled out, like a stroke or a tumor or something of that nature, or multiple sclerosis, then you may want to think about gluten. I'm not diagnosing you. I'm not telling you what to do. I'm just giving you some ideas and food for thought to start a conversation with your doctors, or if you have questions, let us know. So again, Gates Brain Health, and we're going to go through a few articles. And this article is out of the ICANN School of Medicine. I believe it's Mount Sinai, in New York. And they were looking at gluten antibodies and its connection to idiopathic cerebellar ataxia, and they found a significant relationship there between people who have ataxia, which refers to lack of balance. So these are individuals with balance problems. So they have balance problems, and there's not a genetic cause to their balance problems. The genetic causes are referred to as the spinocerebellar ataxias, and within neurology there's many different conditions that also can cause ataxia, like multisystem atrophy type C and Friedreich's ataxia and all these different derivations. But in essence, they're saying when all that's been ruled out, then you want to think about gluten. So that's interesting. And as we go through this one, this is a great review article out of the European Society for the Study of Celiac Disease, Guidelines for Celiac Disease and Other Gluten-Related Disorders. And I talk a lot about gluten-related disorders with my dizziness patients, because people who have gluten problems and they may not have celiac disease. Celiac disease is where the immune system is literally attacking the intestines. It's an autoimmune, meaning the immune system is attacking us. Autoimmune response to the intestinal lining when individuals eat gluten who have celiac disease. Well, people can have gluten problems and not, or individuals can have gluten problems and not have celiac disease, and those are referred to as gluten-related disorders, particularly for relationships to the brain. So your brain is one of the most sensitive areas in your body in terms of a gluten attack, and that research has been done for many years, but really the foremost researcher now is Dr. Hajivasulu out of the UK. He's at, I believe it's the Sheffield Ataxia Center. It's out of Sheffield in the UK. That's where he does a lot of his research. Nonetheless, you can see here 13.3.1, gluten ataxia is the most frequently reported neurological disturbance in celiac disease. The data from Sheffield suggests a 20% prevalence of gluten ataxia among all patients with ataxia and 40% among all patients with sporadic ataxia. So that's pretty interesting. It's a very high number there. So when they don't know the cause, basically 20% for all ataxias, and for sporadic, where they just come about, most of the time it's going to be gluten ataxia, or 40% of the time. And the blood tests for gluten ataxia lots of times are different from the blood tests from celiac disease. Celiac disease involves the tissue transglutaminase enzymes most commonly. But for patients who have gluten ataxia, often they're going to have gliadin antibodies. So that's important. If you want to know, that's a little tidbit of information. Okay. Now, this is a fantastic review article. I believe this was published in fairly recently. This one was accepted in September of 2018 out of the journal Nutrients. Dr. Hajivasulu is the lead author on this, and they go through talking about gluten ataxia without enteropathy. So these are individuals who have balance problems, but they don't have signs of celiac disease in their GI tract. And one of the things that Dr. Hajivasulu has done is he's done a special type of MRI looking at inflammation of the cerebellum. It's called MR spectroscopy, where they can look at certain chemical compounds surrounding an area of the brain. So they were looking at what's called the NAA to creatinine ratio, or I think it's N-acetyl-aspartic acid or N-aspartic acid. Forgive me for pausing on that. NAA, N-aspartic acid, I believe. And so he looks at N-aspartic acid to the creatinine ratio, and he saw that there were signs of all this inflammation in the gluten ataxia patients. And here you can see basically the changes going on a gluten-free diet versus no diet in these ratios for gluten ataxia individuals. So you literally can see signs of inflammation change on brain MRIs with gluten-free diets for those who have gluten ataxia. So that's pretty significant. Now, this is one of my favorite articles. This came out in 2002. For me, this was the groundbreaking article. There was other evidence before this about gluten antibodies attacking the nervous tissue, the nervous system tissue. But here, it's a very in-depth article regarding how immune cells to gluten antibodies attack the cells of the cerebellum. And here, Dr. Hajivasulu showed that the Purkinje cells, which are the outer covering of the cerebellum, you literally have about as many neurons here in your cerebellum as you do in the rest of your brain. So he found that gluten antibodies attack and, for all intents and purposes, kill Purkinje cells of the cerebellum. We also found that they kill other areas of the cerebellum too, and you can also see signs of inflammation in other areas of the brain and other gluten-related conditions, and the spinal cord for gluten ataxia patients. That was later. But in this article, he talks a lot about the cerebellum. And so if you have dizziness, if you have balance problems, and no one's able to figure out the cause of your issues, that's where I'm advocating dig a little deeper. Let's think outside the box. That's where with the Meniere's video I just did, they're finding associations to GI inflammation and leaky gut syndrome in Meniere's patients. Here we're talking about if you have balance or dizziness issues, get your gluten antibodies checked and your TTG antibodies checked, because tissue transglutaminase, because these gluten antibodies and or TTG antibodies may be inflaming your cerebellum. This is the balance mechanism in your brain. This is the area that puts together the information from your eyes, your inner ears, and your neck and your feet to say, where am I relative to my surroundings? And so if this area is under attack by the immune system, that might be causing issues. And yeah, this is the 2020 review article. Also, Dr. Hajivasulu is not the lead author, but he's kind of the one, in my opinion, leading all of this research. And so in this article, they go through all these other articles that have been done on gluten. You can see loss of Purkinje cells in the inferior olives. That's dating back to 1995, 1966. Loss of Purkinje cells, atrophy and gliosis of the dentate nucleus. That's the outer nucleus of the cerebellum. I mean, that's back in 1966, discussing how gluten is affecting the nervous system. That's why I wanted this to be in there. And there's lots of other research throughout the years. Here they're just kind of summarizing finding. They're seeing effects in muscle tissue in the 90s and the late 2017, 2018 period. Dr. Hajivasulu has talked about inflammatory myopathies being associated with gluten intolerance. And this is one of the slides I really want you all to see. So this is a cross-section of the cerebellum. This is normal. Okay, so let's all pause. This is normal, what the cerebellar tissue should look like under a microscope. Again, cerebellum, the outer portion. In fact, I'll separate it here so you can see it better. Outer portion of the cerebellum is made of Purkinje cells. Purkinje cells. Inner portion, we have deep cerebellar nuclei. Outer portion, Purkinje cells. Here you can see what normal Purkinje cells look like. They're very dense. This is in a patient who has gluten ataxia. So again, complete loss of Purkinje cells in the cerebellar cortex of a gluten ataxia patient left. Normal cerebellum from a control patient on the right shows the single layer of Purkinje cells. So that looks nice, that doesn't. So that's literally what's happening in the brain of someone who has gluten ataxia, where the gluten antibodies are attacking the cerebellum. This is also another slide of someone who had gluten ataxia and the effects on the back half of the spinal cord atrophying in essence. These are signs of excessive immune cells within the muscle for someone who has an inflammatory myopathy associated with gluten. I think this was a polymyositis patient. Technically, gluten myopathy is how he's referring to it, but I believe it was a polymyositis patient. And then this is basically gluten encephalopathy. So another related disorder to gluten where the gluten is resulting in all these immune cells being in the cerebral cortex, called gluten encephalopathy. So you can go ahead, I'll just leave this slide up here if you want to read through the discussion. It's pretty interesting. He talks all about small fiber neuropathy and other types of neuropathy. Dr. Hadjivassiliou in 2006 in the Journal of Neurology, I believe, or Neurology, Neurosurgery, and Psychiatry came out and showed that like a third of idiopathic neuropathy patients have a gluten-related disorder where the gluten is attacking their nerves and it's separate from B vitamin deficiencies. And then this is, let me see, this is another article talking about the overlap of TTG antibodies. So in essence, here you can see in the conclusion, let me see here, let me go back. I hate it when we have that little bar at the bottom. Let me see here. In a prospective cohort study of patients with a new diagnosis of celiac disease at a gastroenterology clinic, so they go to their GI specialist, neurological deficits were common, and 40% had circulating antibodies against TG6. Within the tissue transglutaminase enzymes, just know some people eat gluten and they develop celiac disease where their intestines are attacked. Other people eat gluten and they have dermatitis herpetiformis where their skin is attacked. That's the TTG3 antibody. TTG2 is more associated with celiac disease. TTG6 is the one associated with neurological compromise, ranging from, could involve gluten ataxia, could involve neuropathy, could involve schizophrenia. Literally, TTG antibodies for the 6th version have been high in schizophrenia. So 40% of these newly diagnosed celiac disease patients had TTG6 antibodies. And they say providing evidence for a link between autoimmunity on TTG6 and brain atrophy in patients with celiac disease. There is a need for early diagnosis, increased awareness of the neurological manifestations among clinicians, and reinforcement of adherence to a strict gluten-free diet. So to avoid permanent neurological disability. So here's the article, you guys can access it, but pretty interesting information here. They're showing signs of atrophy in the thalamus of patients who have these issues. So bottom line, if you have an undiagnosed neurological disorder, it's always probably worth it to talk to your doctor about having basically a full celiac panel and anti-gliadin antibodies checked. What I didn't put in here is that Dr. Hadjivassiliou is arguing that our reference ranges for what's normal and what's abnormal on the gliadin antibodies is incorrect based on his research. This is really important. So they were finding that much lower levels of gliadin antibodies were actually associated with gluten ataxia based on the MRIs he's performing, where he's seeing all this inflammation in the brain, and then he puts these individuals on a gluten-free diet and the inflammation goes away and their ataxia improves. So he's arguing that our baseline for gliadin antibodies is wrong. It needs to be much lower for it to be accurate, and that's based on MRI studies. So very interesting information. If you have a gliadin antibody test that's negative, there are other specialty labs that we use at Gates Brain Health that can also aid in that diagnosis. So I hope this is helpful. Share, subscribe, share it with your friends, like us on Instagram, all that stuff I have to say. There's our contact information if you have any questions. Thanks for watching. Have a lovely Saturday, everyone, and I'll be back soon with more broadcasts.